This is going to be Understanding EKGs, Chapter 7, Introducing the Sinus Rhythms. Introducing the sinus rhythms. Objectives. Discuss the origin of the sinus rhythms. Identify the components of an electrical conduction system of the heart. Identify a normal sinus rhythm, including EKG characteristics. Describe a sinus bradycardia rhythm, including EKG characteristics. Identify a sinus tachycardia rhythm, including EKG characteristics. Describe a sinus dysrhythmia, including EKG characteristics. Describe a sinus arrest rhythm, including EKG characteristics. Discuss the clinical significance of sinus rhythms. Origin of the sinus rhythms. The rhythms are classified according to the heart structure in which they begin, or their site of origin. The sinoatrial node generates impulses at a rate of 60 to 100 beats per minute. So in this entire area, we're going to start looking at intrinsic rates, and the intrinsic rate of the SA node is 60 to 100 beats per minute. This is an inherent or intrinsic rate of the heart's primary pacemaker. Rhythms that originate in the SA node are called sinus rhythms. So any rhythm that starts from this point here has a rate of 60 to 100 beats per minute, and all other normal findings on your EKG or your tracing are normal, are going to be considered a normal sinus rhythm. Components of the electrical conduction system of the heart. Electrical impulse originates in the SA node, which is right here, the sinoatrial node, travels through the interatrial or internodal pathways, which are these here, kind of spread around, and what these pathways do is they allow the electrical stimulus to spread across the atria so that both the left and the right atria contract simultaneously. The AB node is a brief pause, the bundle of His. So whenever the conduction system fires, the atria contract, the waveform hits this AB node, and just for a second or two, hits the bundle of His. Right and left bundle branches is where it goes to next. So after the bundle of His, and after we fired at the SA node, it's traveled across the atria simultaneously contract. The wave hits the AV node, goes to the bundle of His, then it branches off into the right or the left bundle branches and into the ventricular muscle. And where that occurs is down here in these things called Purkinje fibers. So as far as the conduction system pathways, we have the SA node, which we'll cover this again, and we'll see the actual intrinsic rates, which are 60 to 100 beats per minute. The internodal pathway spread it across the atria and to the AV node. The AV node's intrinsic rate, 40 to 60, which then after the AV node it hits the bundle of His, and then it goes into the left and right bundle branches, and then from there it goes to the Purkinje network. And this is actually at the heart muscle level. This also has an intrinsic rate of 20 to 40 beats per minute. Pacemaker sites, and we're going to grade them or rate them by their intrinsic rate. So the SA node's intrinsic rate is 60 to 100 beats per minute. The AV node's intrinsic rate is 40 to 60 beats per minute. And the Purkinje network, or the muscle tissue of the myocardium or the ventricles, is at 20 to 40 beats per minute. Normal sinus rhythm. The only normal rhythm is normal sinus rhythm. All answers in your 5-step approach on this rhythm must be answered within normal limits. Again, just a quick brief before we go into this. Actually, we have another one on the next slide, so give me just 1 second here. The SA node has generated an impulse that followed the normal pathways of the electrical conduction system. And this is what I want to review with you one more time. SA node fires. goes into the interatrial pathways or their internodal pathways, hits the AV node, goes through the bundle of His, goes down the right or left bundle branch, and then to the Purkinje fibers, which transmit it to the muscle. Now, each one of these sections has its own intrinsic rate. This one here is 60 to 100. This one here is 40 to 60. And the actual ventricular muscle itself is 20 to 40. Normal sinus rhythm still. The heart rate falls within 60 to 100 beats per minute. A variation of 10% is acceptable. Atrioventricular rhythms are regular. The P wave precedes each QRS. The PR interval ranges from 0.12 to 0.20 seconds, and I told you in a previous slide set that the PR interval should be no more than 0.20 or 5 boxes. The QRS complex is less than 0.12 or 3 small boxes, and all 5 parameters are within normal limits. The rhythm is normal sinus rhythm. So as we go through our 5-step process, step 1 being what is the rate, and this is either going to be by a 6-second strip method or an R to R method. What is the rhythm? Is everybody regular? Are there P waves before each QRS? And are they PURU? And PURU stood for P waves, upright, round, and uniform. The next question, step 4, is what is the PR interval? And it should be less than 0.20 or 5 small boxes. On step 5, do all the QRSs look alike? If they do, then the yes is the answer. And what is the length of the QRS complexes? And they should be less than 0.12, and this is all 5 steps. So again, what's the rate? What's the rhythm? And this is both atrial and ventricular. Is there a P wave before every QRS? And are they PURU? P waves, upright, round, and uniform. And what is the length of the PR interval? It should be less than 0.20 seconds. Do all the QRSs look alike? If the answer is yes, then what is their length? And the length of those should be less than 0.12. So here we go on our first rhythm strip. We're going to use 2 methods here. We're going to find one that is very close to that upright large line, and then we're going to count these boxes, these big large boxes off. 300, 150, 100. It's a little less than 75, or I'm sorry, a little more than 75 beats per minute by the R to R method. We should count these as well. 1, 2, 3, 4, 5, 6, 7, and if we look at this over here, probably a half. We have 1 QRS that's about halfway on this. So right at about 75 beats per minute or so, give or take, maybe a little more than 75 beats per minute. Whenever we're looking at this, are the P waves also uniform? In this case, they are all uniform. They are assigned to a QRS, and they look like they come from about the same location. Step 2 on this is regularity. So we're looking at all the R to R intervals and seeing if they're nice and regular, and they do look like that they are. And we're looking at all the P intervals and seeing if they look all nice and regular, and they do as well. Third step on this is to check the PR interval. We should look at least a couple areas on here. 1, 2, 3, 4. We have 4 boxes, which is 0.16. Each small box is worth 0.04. And let's look at another spot. Here. 1, 2, 3, 4, and this one as well is 0.16, or 4 small boxes. The next question that we should ask is, are the P waves present, and are they PURU? Are they present, upright, round, and uniform? And all of them look like they're coming from about the same side. So each one of these are Puru. The PR interval is less than 0.20. Last question, step 5, I got this kind of flip there, is going to be looking at the QRS. Does all the QRSs look uniform? And the answer is yes. And the next question is the QRS less than 0.12? And it is 2 boxes, which is 0.08, or 2 small boxes. So yes, it is less than 0.12. This is normal sinus rhythm, and that was all 5 steps. Again, taking a look back at it, what's the rate? What's the rhythm? Is there a P wave before every QRS, and is it Puru? The answer is yes. Step 4, what is the length of the PR interval? It needs to be less than 0.20. And step 5, is there a QRS, and do they all look alike? If the answer is yes, what is the length of these QRS complexes? And if they are less than 0.12, then that is normal as well. This is normal sinus rhythm. Sinus bradycardia, our next rhythm. Rhythm may resemble a normal sinus rhythm, only the difference is the heart rate. Brady means slow. So the SA node discharges impulses at a rate of less than 60 beats per minute. This one variable makes this an abnormal rhythm. Causes of sinus bradycardia may be caused by an intrinsic disease of the SA node. Vomiting can cause this, hypoxia, hypothermia, or being cold, very, very cold at the core, electrolyte imbalances, or effects of certain drugs. Example of this is going to be digitalis, morphine, beta blockers, calcium channel blockers. Anything that would block conduction of the actual myocardial tissue could affect this. It may be a normal phenomenon, as in well-conditioned athletes or patients who are sleeping. If you have Lance Armstrong, his heart rate is probably going to be bradycardic in his normal resting state. We are not going to give him a loading dose of atropine or something to correct the sinus bradycardia if he has one. The difference between Lance Armstrong and someone else that would be exhibiting signs and symptoms of bradycardia is what is he interacting with his environment with, or what does his clinical indication say? If Lance Armstrong had a heart rate of 30 and he had a blood pressure of 80/40, his skin was diaphoretic, and he was short of breath, we would probably find the clinical indications there to start treating his bradycardia, or it would be suggestive that the bradycardia is what was giving him those signs and symptoms. Sinus bradycardia, 5 steps is always going to be the same. Rate, rhythm, is there a P wave, and is it Puru? Is my PR interval less than 0.20? And do I have a QRS, and is it less than 0.12? The one thing that sticks out in this sinus bradycardia is this right here. Sinus bradycardia means that everything is normal except you have a heart rate that is less than 60 beats per minute that is sinus originated. R to R method, start off with it, 300, 150, 100, 75, 60, 50, 40, 38. This is pretty slow. Greater than 38, less than 40. By the 6-second strip method, 1, 2, 3, 4 times 10, 40 beats per minute. What is the rhythm is the next step. Do all of the P waves look like they're rhythmic? And the answer to that is yes, they do. And then the next question after that, does all the ventricular rates look rhythmic as well? And it does as well. This is still the same rhythm. We've done step 1 which is 40 beats per minute. Step 2, which is regular. Step 3, which is there a P wave before every QRS? And the answer is yes, there is. And the next question you should ask is that P wave Puru, which is upright, round, and uniform? And the answer is yes. So step 3, there's a P wave present, and it's Puru. Step 4, we're looking at the PR interval. PR interval in this case is 4.16. So that's less than 0.20. The PR interval is normal. Last but not least is the QRS. Is there a QRS for every one of the beats? And yes, there is. And is the QRS duration less than 3 boxes? And it's about 2 boxes, so 0.08 is what the QRS duration is. This is sinus bradycardia due to the heart rate being less than 60 beats per minute. And the reason it's called sinus is because it originated at the SA node. There is a P wave that is present. Sinus tachycardia rhythm pretty much means fast heart rate. And sinus rhythm originated at the SA node. The only difference is the rate. Rate generally considered between 100 and 160 beats per minute. Later on, we're going to learn that anything greater than 150 beats per minute with no P wave visible is probably an SVT of sorts. So this tachycardia SVT rates will kind of overlap one another. But anything greater, more specifically, than 100 beats per minute is considered a tachyrhythm or a tachycardic rhythm. Sinus tachycardia. Causes include exercise, fear, stress, pain, anxiety, ingestion of stimulants, coffee, cocaine, methamphetamine. May result from hypovolemia, which is too low a volume, your heart rate increases so that you get a better cardiac output, congestive heart failure, severe dehydration, or the acute MI, an acute myocardial infarction. The only thing that's different, all of our intervals are normal in this. Less than 0.20, less than 0.12 for the ventricular area. It's regular. There is a P wave and it's Puru. This right here is the thing that is different, which you have a heart rate greater than 100 beats per minute that is sinus originated. We're going to find one, do an R method. 300, 150, greater than 100, less than 150. There's a P wave. They are rhythmic. What I mean by that is the P waves come at the correct intervals. QRSs come at the correct intervals. Everything is nice and regular. That's going to be step 2. Step 3 is there a P wave before every QRS? Yes. Is it Puru? Yes, the P waves are upright, round, and uniform. Or pretty much round. They have a rounded shape to them. Step 4 in this is going to be the PR interval, which is 4 boxes or 0.16. And the next step is there a QRS? And there is. And what is the width of the QRS? Which is 2 boxes or 0.08. This is sinus tachycardia due to it being originated from the SA node because there's an upright P wave, A2, and it's greater than 100 beats per minute. A sinus dysrhythmia. Same as the normal sinus rhythm except for a slight irregularity of the heart rhythm. The rate of the impulse formation in the SA node may vary with respirations. This means from P to P and R to R intervals change with the respirations. Increases in inspiration and decreases with expiration. Sinus dysrhythmia still. Should be a difference of at least 0.8 seconds between the shortest and the longest R to R interval. So you're going to have to mark these out. You're going to have to measure them out. Common and normal findings. Causes may include an MI, sick sinus syndrome, The administration of certain drugs, examples of this are going to be digitalis or digoxin, and it varies with respirations, and this is still a sinus dysrhythmia. So the actual rate is now going to be at 60 to 100 beats per minute. It's sinus, but the irregularity is how we are going to identify it. Is there a P wave before every QRS? Yes. And are they PURU? Yes. What is the length of the PR interval? Less than 0.20. And do the QRSs all look alike? Yes. And the QRS width is less than 0.12. Now, the only thing that sets this aside is going to be step 2, which is what is the rhythm? And it is irregular, and the variance on this is more than 0.08 seconds or 2 small boxes. The sinus dysrhythmia, if you'll notice, these distances will change. If you'll notice in this area here, this one got wider, this one's wider even a little bit more still, and so is this one, and this one as well. These are all wider, and this right here is about the same as this is right here. Now, whenever we're looking at these, we're still going to go through the 5-step process. So this area here is the area that is actually going to be this dysrhythmic. It's not in rhythm. It is a variation, and it's a variation more than 2 small boxes. So I'm going to erase this, and we're going to go through the 5-step process. So step 1. Step 1 is rate. We can do R to R. The problem with an R to R interval on this is that it is irregular. This distance is different than this distance, so we're better off doing the 6-second strip method. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 times 10 is 90. Step 2 in this. Step 2 is going to be regularity, and it is irregular. The irregular probably occurred during inspiration, which is during this section here. Step 3 is PURU. Are the P waves upright, round, and uniform? And they pretty much are, even during the irregularity. The next step on this is to test PR interval, and the PR interval here, 1, 2, 3, 4, is 0.16. Next step on this is to look at the QRSs, and the QRS width is pretty much 2 boxes or 0.08. So everything's in normal except for the irregularity, and the irregularity is greater than 0.08 seconds here. So we have 3 large boxes in between these 2 R intervals, and 1, 2, 3, 4 large boxes in between those 2. So it's definitely irregular in that spot. So this is a sinus dysrhythmia. Sinus arrest rhythm. The SA node fails to initiate an impulse. Absence of a PQRST complex is noted on the rhythm strip. Causes a slight period of cardiac standstill. Lasts until the sinus node continues its normal function. Causes include hypoxia, ischemia, damage to the SA node, or administration of certain drugs such as digitalis or salicylates. Also occurs as a result of an acute myocardial infarction. These occurrences are infrequent. Patient assessment is imperative. You have to see what's going on with your patient, and you have to understand what the clinical indications are. If you see them, then they are present. The sinus arrest rhythm. The one thing that's going to stand out as we're looking at the 5-step process is this section here. What is the rate? And that depends on if we initiate a sinus arrest or not. So if we have a sinus arrest on this, there's going to be a blank spot where something should be going on but is not. Step 2 on this will kind of coincide with our first answer. It's irregular whenever the sinus arrest is present. So whenever that thing's going on, we have things that are nice and regular before here. The sinus arrest occurs, and we have things that occur that are regular after it, but during this arrest part, there is no activity. Step 3 on this is there a P wave? The answer is going to be yes whenever it's fired from the SA node. And are they PURU? And the answer is going to be yes, they are whenever it's conducted. What is the length of the PR interval? The PR interval should be less than 0.20. Do all the QRSs look alike? Yes. And they're going to be less than 0.12. It doesn't take a rocket scientist at this point to figure out that we're missing something in this section here. Matter of fact, if we look at the distance between these two, 1, 2, 3, and about a half of the large boxes. 1, 2, 3, and a little over half, so it's pretty rhythmic. This before and this after are about the same rhythm. Just during this time period right here is where we had the sinus arrest. So, erase all this and we'll go through our 5-step process. Step 1, we should look at the rate. And this is going to be dependent on how many times we see the arrest. 1, 2, 3, 4, 5, 6, about 60 beats per minute of what I'm seeing here with a 6-second strip method. Step 2 in this is it regular? Well, it's definitely not regular whenever that's occurring. The other parts are sure regular, but this area here sure isn't. Step 3 on this, is there a P wave before every QRS? And yes, there is. And they are PURU. They are present, uniform, whenever it occurs and it's conducted through a QRS. And they're upright and round. Part 3 on this is a PR interval. So if we look right here from the start of the P wave to the first deflection, 1, 2, 3, 4, 0.16 is the number I come up with there. Last but not least, or step 5, is the QRS. And is the QRS, how wide is it? And missed on that line there. The QRS is about 2 boxes, or 0.08. So this is less than 0.12. Everything else is normal except for this area right here, which is where the sinus arrest had occurred. That ends Chapter 7, Sinus Rhythms.